Welcome to this explainer. Today, we're diving straight into the mechanics of Donald Trump's newly announced generic drug tariff proposal. We're cutting right through the political noise to look strictly at the facts and the mechanics of the policy itself. So let's get right into the numbers. So what exactly is this new generic drug tariff plan? You know, when complex trade policies drop, they can sometimes sound like a massive jumble of percentages and dates. But the absolute best way to grasp how this would actually function in the real world is to simply break down the timeline. Now, what's really notable here is the target. We're not talking about a blanket tariff on all imported goods. Nope. This proposal is highly concentrated. It specifically targets the generic drug market, using an economic mechanism that's literally designed to escalate over time.
All right, Section 1, the escalating timeline.
The proposal outlines a very clear three-phase timeline, and it escalates dramatically. It's distinctly chunked out into an initial period, a sudden transitional spike, and then a permanent cap. The whole policy shifts from absolutely zero tariffs initially straight into some seriously steep penalties. Step 1 covers years 1 and 2, Step 2 hits right in year 3, and Step 3 covers year 4 and beyond. Let's isolate that first step for a second. For the first 2 years of the plan, the generic drug market would remain completely untouched by these specific new duties. Basically, it's a 24-month window at a clean 0%. But then, in year 3, we see a massive structural pivot. We go directly from a 0% baseline all the way up to a 100% duty. It's an incredibly sudden economic barrier introduced in just a single step.
Which brings us to Section 2, the final tariff cap.
In year 4 and beyond, the tariff actually reaches its permanent ceiling at a massive 200%. To put that into perspective, this essentially means the duty placed on the generic drug is double the value of the drug itself. That is a huge leap.
Jumping from 0 to 100 and capping out at 200%. There is absolutely no gradual slope or incremental hike here. It is a dramatic, tiered acceleration.
So the real key takeaway here is that this isn't just some vague objective. It's a highly specific, strict chronological blueprint. The entire mechanism relies on this exact sequence to fundamentally shift how generic drugs are imported and priced.
Which leaves us with the big question. If a policy steps from 0 to a staggering 200% cap, how is that ultimately going to reshape the global generic drug market and its supply chains? Definitely keep this timeline in mind as the discussions around this policy continue to unfold.